Well, D2D, or Drive to Deprescribe, is an initiative that actually really came up from the brainstorming that the leadership group, which basically includes chief medical officer and other executive and chief nursing officers, that actually was started to meet at AMDA annual meetings many years ago and has turned into a robust group. That group actually came together and decided that we really should be engaging in as leaders in many healthcare systems across the country to come up with an initiative that we can connect with everyone. And this group basically thought of many projects and finally decided on the fact that in this country we struggle with polypharmacy issues. Basically, a lot of our nursing home and long-term care residents end up taking a lot of pills. So I think it was a very easy consensus in the end that that's some low-hanging fruit that we all leaders can focus on and start making significant changes. And so that's how this initiative came about. It's about really optimizing medication and most of the times getting people off many unnecessary medications that they have been taking for years. I think why D2D suddenly became a very popular initiative is because we all kind of struggled with the fact that in our healthcare system and our healthcare environment in this 21st century, in a country like US, we have patients who are taking more than 20, 30 pills at a time, right? I mean, personally, myself or for my family members, that would bother me, right? So I don't know why there had been some inaction in this realm in our healthcare systems that we let that happen as a healthcare environment. But at this point, it was very easy on everybody's mind that we can do something about it. Let's get together. So it was a very easy sell, right? I mean, and all the win-win that can come from focusing on an initiative like polypharmacy optimization, medication optimization, and deprescribing unnecessary medications. There's just so many wins you get from it, right? You get patient outcomes to improve, you can get staff work issues and workflow issues and burden issue in a time where we are struggling with staff shortages and burnout and so forth. I think it quickly became a very easy sell to everyone in the healthcare environment. Nobody would disagree that it is an initiative that really needed our attention and focus. Unfortunately, it is correct that in the post-acute long-term care, polypharmacy issues are more inherent than other settings. And I think one of the reasons probably behind that is because we do have patients who have a lot of frailty, who do have a lot of complex medical needs. And in the end, if we do not provide very person-centered or very interprofessional care, you can imagine that you can quickly gather people on tons and tons of medications, as you can see. But I think the only way to get rid of this problem is to come together and talk about these things. So I think what we are trying to promote with D2D is really that interprofessional collaboration. Really, how can a director of nursing and the pharmacy consultant and the medical director and the nurse practitioner and the family can start talking about those things, right? So what we are doing with the D2D initiative is nothing fancy, really. We basically say that we are just creating the energy. We're just creating the cheerleading. And this AMDA partnership and AMDA leadership on this issue is all about creating focus, energy, and cheerleading. The rest of the work is going to be done by the team at the facility. So it's really going back to our roots of geriatrics, which is let's get interprofessional, let's start talking, and let's put the patients in the middle. So that's the work we are leading with this work. Well, I think it has been one of the most fulfilling initiatives that I have been part of, and many other colleagues who are helping in this initiative actually feel the same way. I think it's, again, this initiative has taken us back to the basics, right? I mean, we're in time in healthcare where everybody's talking about the big rocket science technology, right? That's going to save the world. It has been very fulfilling to come back to the basics and talk about, like, hey, we learned interprofessionalism, we learned communication, we learned patient-centeredness and person-centeredness in geriatrics, but we have not really practiced it well, right? So this initiative has given us the opportunity to come together as a better team. To me, that has been the biggest success. But also besides that, we have been able to clearly highlight the important role other professionals have on the team. It's not just about doctors and prescribers, right? I mean, what is the role of the DON? What is the role of the pharmacy consultant? What is the role of the family member, right? So we have been able to highlight again through this initiative that how valuable they can be. They always have been, but they can further be. So that has been the most fulfilling thing. And then the numbers are speaking for themselves. We have seen many drug categories that are significantly moved because of this initiative. We actually have the partnership of long-term care pharmacy partners, and they are actually giving us data on thousands of patients who are part of this initiative through many organizations that have signed up, and we have seen that we have moved the needle in the right direction. But on some drugs, for example, sliding scale insulin, hypoglycemic agents, multivitamins, the sleeping agents like the Z drugs, we have seen that we have shown significant improvement already. It is very exciting that there's many different directions we can go forward with D2D, right? I mean, we already have learned so many important lessons. We already pivoted. But what excites me about the future of D2D is we really want to get the organizational leaders to be more involved. We really want that we have many chief medical officers, many chief nursing officers, and chief pharmacy officers really coming and joining our calls and pushing this agenda of medication optimization and deprescribing at their organizations. So I think we have had some engagement from such leaders, but over the next few weeks and months, we are going to campaign harder to get these chief physician, pharmacy, and nursing leaders to be involved. So that's number one. Number two, we're also going to deep dive into some of the success stories, because we absolutely have some heroic work being done by many facilities and many physician leaders and other leaders at a facility level. Over the next few weeks and months, what we're trying to do is really create a group called the Spearhead Group. And the purpose of the Spearhead Group would be for us to really have a conversation with these superstars of medication optimization and deprescribing, to learn from them, from their stories, that what are some of the innovative ideas and strategies they were using. So really dissecting the success we have had so far, and then extracting the lessons from it, and then disseminating those best practices to rest of the people. To us, we're really excited to looking forward to that deep dive. Well, the last thing I'm just going to say is that, guys, AMDA and the D2D team together, we have created an amazing platform for having one of the most unprecedented success at a national level. So I would really challenge all of you who's listening to this lesson from the D2D team and AMDA, please jump in. Be more engaged with this. We have done all the hard work that was required to build this platform. Now let's show the world what we can do together as a team. Let's move this needle on polypharmacy. Let's make our healthcare setting the safest healthcare setting in the country.